Mariel has two clinics here in Sydney, one in Bella Vista, one in Belmore. She has a 9-month-old daughter at home, Amelia. She is a fan of Peaky Blinders. When I say she, I mean Mariel, not the 9-month-old. I don't think that would be a good show for Amelia to watch. But Mariel enjoys watching Peaky Blinders as well as Selling Sunsets, the real estate reality television show. She also has a dog, so I'm going to say she doesn't like cats. Her dog is called Louie, and Mariel's favourite song is currently Twinkle Twinkle Little Star, because that is her daughter's favourite song. Ladies and gentlemen, it is time to welcome to the stage, I'm going to say it, she is the only cosmetic injecting lawyer speaking today. Please put your hands together and welcome Mariel Tan.
Oh my gosh. Thank you. Thank you. So in aesthetic medicine, we've spent years focusing on volume and contour. And while those factors are important, patients are now judging their results in something much more fundamental, which is their skin quality. Skin texture and tone are now what we define a natural result. Today, I'll be exploring this shift and what this means for us clinically and how we can better align ourselves to what our patients actually want and what the Quadessy platform can actually do for you and your clinic. I'm Mariel Tan, I am a lawyer, I am a cosmetic injector, and I do have experience in body contouring treatment. And today I'll be exploring the Quadessy device. Over the last decade, there has been a big shift in aesthetic medicine. Previously, as you can see in this image, everyone wanted big lips, sharper jawlines, cheekbones, and honestly, they didn't care too much about their skin. However, nowadays, we're seeing a big shift. People only care about their skin now. They want clear skin, bright skin, better texture and tone. And you can see this in celebrities like Lindsay Lohan. As you can see with her previously, when she was younger, she had very poor texture, poor tone, very thick makeup. However, nowadays, she's older, but she looks more age appropriate. She looks more refined, she looks better, and she looks more confident. So what is skin quality? All of you are experts in the field, but skin quality is your texture, the tone, laxity, appearance and pore size, hydration, reflectivity. However, skin quality is not a single concept. It is multi-layered. You need to look at all the different layers in the skin, from your epidermis, if there's any epidermal changes, the dermis, and also the subdermal structures. And this is why multi-energy approaches is vital in everyone's practice. It is so important to do a multi-layer treatment because it targets different areas of the person's face. As we all know, yes, we lose 1% to 2% of collagen every single year as we age, but you also lose bone. Our bone atrophies over time, our fat pads shift and also deflate. So it's very important to also target and be mindful of these aging processes. And that is why we found that there's a massive treatment gap in clinics. So this is why radiofrequency microneedling became essential in everyone's clinic. As we all know, radiofrequency microneedling is great because it induces more collagen stimulation, helps with texture, tone, appearance and pore size. You can even use this for stretch marks for those people who actually do body contouring treatments. You can even use this for hyperhidrosis. So there's a wide range of things that you can actually treat with radiofrequency microneedling. However, not all devices are made equal. I don't know about you, but I have tried multiple RF devices and it is extremely painful and at the same time, the results are not consistent. Well, let me tell you that we have a device called the Quadessy that addresses all those concerns. So what is Quadessy? Quadessy is the next generation of radiofrequency microneedling that integrates multiple technologies to provide you with an advanced platform. So in summary, it has hybrid thermal coagulation. This preheats the skin to 45 to 55 degrees to create a nice thermal environment. What I love about this is that it actually tricks your nociceptors, which blunts the sharp pain signals. Second, you have the energy cruise control with real-time impedance monitoring that automatically adjusts output. Why this is so important is because you're reducing risk of overheating, burns, folliculitis, and all the other issues. Another one is a quad fusion drug delivery system with a dual depth approach. Previously, in other devices, each pass is a single depth, meaning you have to go 2 times, 3 times, which causes more pain for the patient, which means they will not come back for their treatment plan, and also it causes issues like overheating. While this, in a single pass, you're targeting 3 different layers of the skin, your papillary dermis, reticular dermis, and of course your epidermis. So now that I've introduced Quadessy to you, Tegan will now be doing our model. So this is my nurse, Melissa. So she's going to be the lovely model today. So Melissa, do you mind sitting up? Okay. See my face this way. So it's really difficult for you to see her, but we'll just wait for the pop-up on screen. She's actually quite stunning, but she wants to brighten her skin even more. She has a bit of skin laxity on her submental double chin fat, but honestly, look at her skin already. She's quite glowy. So what we're gonna be doing is we're gonna be doing the dual depth approach. The first step, we're going to be doing 0.8, and then the second pass to 1.2 millimeters. So we're really gonna be targeting that epidermis and also that papillary dermis and reticular dermis. So you can see during the treatment, it's not going to be painful. She's definitely not gonna be crying on stage, and I will come back to her later. So lay back down. So the first technology I wanted to talk about is the hybrid thermal coagulation, and this is probably my favorite thing about this device. So it has quad plates that preheats the skin to 45 to 55 degrees. And what's great about this is that it actually blunts the sharp pain signals. For those people in the crowd who has tried radiofrequency microneedling, it is incredibly painful. I've had compound numbing and kept it on for an hour, and my pain was a 10 out of 10 in other devices, but I have tried this without numbing cream, and honestly, it was a 4 out of 10 for me. So with numbing cream, the patients will feel maybe a 2 or a 3 out of 10. Also, preheating the skin to that nice optimal temperature allows tissue receptivity, patient comfort, and improves blood flow and cellular activity. So why does preheating matter? Well, the tissue becomes more conductive, which is less painful, you need less aggressive energy, and you get less nerve stimulation, which means more patient comfort. And this is so important because honestly, having a device in clinic, you want the patient to keep coming back and really finish their treatment plan. If a treatment is so painful, it's so difficult for you to get your patients to come back. But with this device, it is extremely comfortable and not as painful. Another feature is a quad fusion drug delivery with a dual depth approach. So how it works is that in a single pass, it's going to go into 3 different skin layers. You have your epidermis, papillary dermis, and reticular dermis. And we all know that the fibroblasts live there. If you stimulate the fibroblasts and you stimulate more collagen formation, then you have better texture, better tone, better pore size. So you're really providing a much more holistic approach to your patients. You do not need to go back again and again and again. That causes extreme trauma to the patient. And you have issues like burns, overheating, folliculitis, and post-inflammatory hyperpigmentation. So this is how it works. Step 1, the physical channels actually happen, and you can hear it. So as Tegan does the actual device, you can hear a noise. Step 2, the channel fixation. So of course, in whatever you want to do, you can use whatever topical drugs that you want to do, so you put it on top. So when the second step happens and releases, the actual drug comes in using negative pressure. The second pass happens, and then that will be positive pressure, and the actual topical agents goes in deeper into the skin to ensure higher absorbability rate. So Quadessy did a study on its dual depth approach, and they found that a dual depth approach is far more effective than a single depth treatment. So this first image is a single depth treatment via the 3.5, and you can see it's rugged. It is not a true 3.5, and the physical channels isn't even, while comparing to the 2 double depth approach. Secondly, they found that the initial pass that has a superficial pass, then doing a deeper pass after, creates a better physical channel, and you can actually see that on the actual last image. You can see that the physical channel is clear, it's more distinct, which ensures that's better drug absorbability. So a great thing about this device is its safety. As a lawyer myself, patient safety is paramount in my clinics, and the amount of clinical notes we do on a daily basis is insane. So energy cruise control is so important for me. This is probably one of the only devices that has impedance monitoring at all times. So it has real-time impedance monitoring. It has automatic radio frequency output adjustment. You have audible safety alerts to prevent overheating. And you have uniform energy distribution. So it prevents that overheating and prevents you from hand-holding the patient because you have prolonged needle tip marks, you have folliculitis, and post-inflammatory hyperpigmentation. So what is impedance? Impedance is actually the resistance to energy flow. So if a person has a higher impedance, it means that there's a higher resistance to the energy, and it's harder for the radio frequency to actually pass through into their face. Lower impedance means the opposite. The tissues, the RF energy flows more easily in the tissues. So this is why impedance check is really important, because we all have different faces, different skin, different thickness, and you want to ensure that there's impedance alarms to ensure that you're actually doing the right approach to your patient. When comparing this to traditional devices send the same voltage no matter what. If there's impedance changes, then the energy becomes more unpredictable, and that's why you get hotspots and burns. However, with Quadessy, it automatically adjusts your voltage and current in real time. The power is also constant and automatically adjusts the RF energy, and every pulse is consistent and delivers a predictable energy no matter what. What I love about this as a clinic owner is that it is so versatile. In my clinic, I have so many different devices, and all my devices, I want to ensure that they're all versatile and I can do different things with it. So, Quadessy comes with the Deep Plus handpiece, which is, of course, your radio frequency tips. It comes with the face and, of course, the body, non-insulated and semi-insulated. What I love about this is because some clinicians do not want to preheat the skin. So you have the option to purchase this without the preheating quad plates or with the actual quad plates. You have the Wave Plus, which is one of my favorites. It's a bipolar radio frequency, and it stimulates fibroblast activity in the person's face or body, which means more collagen. So you have low mode and also deep mode. So deep mode, of course, goes deeper into the dermis, and the low mode, you go quite more superficial to really stimulate that collagen remodeling. Another handpiece is a Smart Cure handpiece, which is great. It uses a monopolar radio frequency tip. And this is great because you can actually subsize deep scar tissue. You can use it in acne and acne scarring, or even fine lines and wrinkles, so you want to specifically target. So seeing all that, you can see that the actual Quadessy device is so versatile. You can use it all over the face, all over the body. I use it on arms, on stomach, especially on postpartum, on like thighs, so it's so versatile. When I compare this to traditional radio frequency devices, traditionally, it's single depth energy delivery, so you have to go in at least 3 to 4 times to really get to that result and targeting all those different skin layers. You have no preheating phase, which means it is incredibly painful. Multiple passes are required, and there's no smart energy cruise control. However, Quadessy is very different. You have the controlled thermal spread. You have the preheating phase to ensure that it's a comfortable treatment. You have all the different hand pieces so you can create different treatment plans, and it's less painful as well for the patient. So I'm gonna ask Melissa. Melissa, how do you feel out of 10?
Like a 1.
1?
Yes, I'm sleepy.
You're sleepy. So she said she's sleepy, everyone. And how does it feel? Does it feel tingly? Does it feel like sharp signals?
Maybe slightly sharp.
Okay, she said
Certain
slightly
areas are,
one.
more sensitive, but it's fine.
And just a 1 out of 10.
Yeah, 2 max.
Okay, so normally if that was me on the bed and I was using a different device, I would be crying already and probably passed out, but she's a 1 out of 10. So clinical indications. So where does this fit in your practice? This is great because you can use this with skin laxity, acne scarring, texture and pore refinement. It's great as well for early structural aging. Personally, in my clinic, I love to use this with different modalities. I have different modalities like the Ultraformer, I have the Clad2 Alpha, which is fat freezing. So I love to actually mix and match my devices because that creates the best treatment plan for your patients. It's never replacing one modality over another. It's about combining them to create the best treatment for your patients. And I also use this with injectables as well. So these are some clinical before and afters. This is an image by Dr. Kim, which I think was incredible. So this patient had 1 Deep Plus handpiece treatment, and you can see deep acne scarring. After 1 session, his acne has now deepened less, which I think is incredible. After 1 session as well, you can see a reduction on this person's pore count as well. And this is 1 week post-treatment. Be mindful that final results of the Quadessy is around 8 to 12 weeks. This is another person as well. So 1 week post-treatment, after the 2nd session, you can see a reduction in his acne scarring, redness. His skin is definitely a lot more brighter as well, and actually much more smoother. These are my personal before and afters in my clinic. This is actually my mom. She's 62 years old, she's menopausal, and her skin is very dull and dehydrated. So she just wanted 1 session, and this is 3 days apart. So you can see my mom's skin is actually a lot more brighter, lesser pigmentation as well, and she actually is tight around that jawline. Please be mindful, this is only 3 days apart after her 1st session. This is a client of mine. We're doing a wedding prep. So she's getting married in literally 2 months. So she came in wanting the Quadessy. So this is 1 session. So we did the Wave Plus handpiece on the periorbital, which is around the eye, and also the full face. Then we did the dual depth approach with the preheating. This is 1 session, 1 week apart. And you can see a reduction in her pores. You can actually see her skin is brighter. And look at the submental fat reduction after literally 1 week apart. And please be mindful, final results, as I said, is in 12 weeks. She didn't do anything else. We didn't do no new skincare. This is just purely the Quadessy device. This is another patient of mine. So she's actually getting married very soon as well. And she came in because she wanted to increase her brightness, reduce her double chin fat. She just wanted to look better for her wedding day. So we did the Wave Plus handpiece, so you can target around the eye. We also did the full face, followed by the dual depth approach with the preheating phase on the radio frequency microneedling. And you can see she looks so much better. She looked like she lost weight, and this is only 4 days apart. Her skin is more glowier. She looks better. Look at that V-shaped face, and most importantly, look at that submental double chin fat as well. There's a big reduction on that double chin fat, and we did not do anything else but the Deep Plus handpiece, and I know because she's my future sister-in-law. So I was tracking them all down. So this is my lovely husband. So we did a skin analysis test on him. So back in May, this was his result versus July 2026. And you can definitely see his skin is a lot more brighter. We only did 1 session of radiofrequency microneedling using the Wave Plus handpiece. We did the periorbital and also the full face. We did the dual depth approach on the RF microneedling, and you can see his skin is a lot more glowier. And trust me, he did not change any skincare, no other treatments, because for him to get to do anything, I have to drag him. So you can see as well on the other side, it's completely glowy. We also tracked down his deep pigmentation. And you can see, I don't know if you can see it on the screen, it's all those green marks, that's his deep pigmentation. Comparing to what it is in July, there's a reduction on this deep pigmentation. And please be mindful, deep pigmentation is so hard to treat because of where it is. It's deep in that dermis. And you can see as well on the other side of his face. So what is Quadessy? Quadessy is a hybrid radio frequency microneedling platform that delivers a more controlled multi-depth thermal energy. So it has great features. It has a hybrid radio frequency delivery, the dual depth precision approach that targets 3 different skin layers from your epidermis, papillary dermis, and the reticular dermis. You have the smart energy cruise control with real-time impedance monitoring that increases that safety profile. You have the quad fusion drug delivery system, and you have the multi-applicator platform. So, the next generation of radiofrequency microneedling is not defined by power, but by precision. Quadessy demonstrates how integrating multiple technologies, such as the preheating phase, dual depth approach, and also the smart energy cruise control, can enhance patient outcomes and clinical efficiency. So we're moving towards a precise energy delivery, a multi-layered approach, and a natural, undetectable results. Rather than treating the skin in isolated layers, we're now able to treat the skin in a nice thermal environment that supports a more uniform and synergistic modeling. We're really seeing a shift in the industry, from correction to now really understanding the skin at a much deeper level. We're seeing a shift from volume to now skin quality, to a surface level treatment, to a much more deeper layer, multi-layered treatment. And with that, the tools we use are evolving. Quadessy represents this shift, not because it does more, but because we can treat with more intention, more control, and with more care. And that is the future of skin quality. So I'm just gonna ask, how you guys doing? You guys finish? So just a note, normal radiofrequency microneedling devices take at least 45 minutes to finish. Because of the dual depth approach, you're cutting your treatment time in half. A full face, I can finish it in 12 minutes. So it's higher clinic ROI, better for you in your clinic, especially for those high patient volume. Less pain for the patient. Imagine from 45 minutes, you're cutting your treatment time to 12 minutes, so the numbing cream will actually stay on and they're not crying during the treatment. So Melissa, you can sit up. So if you face the camera, she's slightly red, and I want you to actually see her in half an hour to an hour. That redness will go by at least 60%. Because of the preheating, it actually has less side effects and less downtime as well. Yeah, thank you.
All right, we have got time for some questions. Thank you very much, Mariel. Does anyone have any questions at all about Quadessy or anything that Mariel has raised? You should feel free to ask if you have. If not, we can ask during afternoon tea, but go for it. Thank you.
Can you elaborate a little bit on hyperhidrosis? Because obviously we do. Thank you. With hyperhidrosis, so obviously we're all probably using neuromodulator, and it can be very expensive to our patients. So what's your approach with Quadessy treating that? That's something I'll be very interested in. And how many treatment would you need? About how the longevity, like how long the result will last?
Yeah.
For client-wise, once we have the machine, if we can utilize it, then we can save a bit of money for our client.
So with hyperhidrosis, as an injector myself, I actually tend to go and lean towards tox. But when I treat hyperhidrosis, the patient needs to come at least 3 to 6 times. It really depends on the patient, because some people, they just sweat profusely. You're targeting in a much more superficial plane when you do hyperhidrosis. So you'll be targeting up to a 1 millimeter depth. It's always good to actually get them treated first after your first session, get them to come back after 4 weeks and see if there's even a 20% reduction on their sweating. But generally speaking, I would say getting him in 4 to 6 times every 6 weeks will be great and really monitoring them. But yeah.
Thank you for that question. Any other Quadessy questions? That's a mouthful. Any other questions? If anyone's got any questions, you're okay if people come and have a chat with you.
Yeah, of course. Yeah.
In that case, please thank Mariel for her presentation. Thank you also to
Thank
Tegan.
you.
Thank you to Melissa. And not just thanks to Mariel, thank you to Mariel's mum, Mariel's husband, Mariel's future sister-in-law,
Yeah.
and any other of Mariel's family who want to make that presentation. All right. So with that, we're